There's been a lot of alarm over beauty jabs as more than 2/3 of people who administer cosmetic surgery injections such as Botox are not medical doctors. This has raised a lot of alarm because only 32% of these non-surgical treatments are completed by doctors, only 70% by healthcare professionals. I'm Dr. Julian de Silva. I'm a board-certified facial cosmetic surgeon. My practice is in central London on Harley Street, and I specialise in only facial procedures. Now, do non-surgical treatments really matter? Well, what are the real risks? Well, there are serious ones, including damage to vision, blindness, damage to skin necrosis. Over 2/3 of people who had non-surgical treatments had experienced long-lasting effects, such as pain, anxiety, headache. So clearly it's important. Well, today we're going to look at non-surgical treatments and what really matters. What are non-surgical treatments? Well, there are three different areas. Firstly, there's Botox. Botox reduces lines associated with movement that often come with age. Secondly, there's fillers, and this adds volume, and by adding volume, it can smoothen out shadows and depressions. And thirdly, there are other treatments. Now, these can be skin tightening treatments, threads, others which are associated with some degree of recovery. Well, what about the results, first of all? Yes, there can be poor results. There can be complications with non-surgical treatments. And there can be a lack of aftercare and follow-up. And this can leave patients with difficult situations as they have to manage complications on their own. And this can include scarring, damage to soft tissues, and ultimately, if their facial treatments can be longer lasting. Secondly, what about safety? Well, without regulation, there's a risk of unqualified practitioners practicing cosmetic procedures, and that means there's a lack of standards or protocols. Now, in the UK, we have something called the CQC, the Care Quality Commission, and this really protects patients by maintaining high standards of care. Without this, there really isn't a safety net. Accountability. Now, in an unregulated market, patients can have limited recourse if there is an unsatisfactory result. The person doing the treatment may not have insurance. They may not have professional indemnity. So if there's an issue, well, there's nothing one can do. What about ethical issues? Well, all doctors take an oath to do what is in the best interest of the patient. This is called a Hippocratic Oath. Now, non-doctors, non-clinicians, there isn't such a requirement. From 2021, in the UK, it became illegal for a person to administer Botox or fillers to a person under the age of 18. And this is really key because we want to safeguard our children from cosmetic treatments. However, in the year before this, the Department of Health estimated that over 40,000 Botox treatments and possibly up to 30,000 dermal fillers were done to children, people under the age of 18. And you could question the ethical dilemma going through with this. What about the psychological and emotional impact? Cosmetic procedures can have a significant emotional impact on patients. Now, unregulated practitioners may not adequately assess a patient's mental health and psychological profile. We all know that there are things like body dysmorphia, but really one needs to actually look for this in patients by asking the right questions, and where appropriate, they may need additional help, not cosmetic treatments. What about lower quality or unreliable products or equipment? For example, really cheap Botox for less than £100 or less than $100, well, it's too good to be true. Taking into account the cost of the product, regulation, insurance, all of these things. If it sounds too good to be true, it probably is. Now, Botox can be really diluted, and that can reduce the cost of Botox, but it's also going to reduce its effectiveness. But what about the filler Antidote? Now, in the UK, you need a medical license to prescribe the filler Antidote, also known as Harley's. And Harley's can dissolve filler. Now, in an emergency, such as the filler blocking a blood vessel, the Harley's wants to be given as an emergency immediately after the filler. However, even though you don't need a license to inject filler, the person without a license is unable to buy hyaluronic acid because it's a medical prescription. So although a person maybe having no license could actually administer the filler, well, they won't be able to get hold of the antidote, so they won't be able to dissolve the filler. That potentially is going to be an issue. Certainly non-surgical treatments remain controversial. Currently in the UK they're unregulated, and this has caused question marks over whether there should be a register in order to protect patients' best interests and maintain a high level of quality and safety. In the meantime, until that arrives, well, it's always important to really ask who's doing your filler. Never go for the low-cost provider because it's not likely to be trouble-free long-term. And even though these are non-surgical treatments do have some risks. And although uncommon, there are some serious risks such as damage to vision and scarring of the skin that we absolutely want to avoid. Hope this has been helpful for you. Thank you for watching.